Hello everyone, welcome to GK Today. Today's topic is WHO awarded WHO Global Health Leaders Award to Asha workers in India. So let's start the video. Asha, Accredited Social Health Activist workers received the Global Health Leader Award 2022 in the backdrop of 75th World Health Assembly. WHO said that the ASHA workers were honored for their key role in linking the community with healthcare, especially during the COVID 19 pandemic. They were among the 6 recipients of this award. Now we will understand who are the other recipients of this award. The other 5 recipients of this award are 8 volunteers, polio workers who were shot and killed by gunmen in Afghanistan in February this year. Second, Dr. Paul Farmer for his contribution to providing service for marginalized people. Third, Dr. Ahmed Hanker for his anti-stigma program that blends storytelling with psychiatry. Fourth, volleyball player Ludmila Sofia Olivria for facilitating access to sports as an alternative to risky behavior in youth. Fifth, Yohei Sasakawa for its global fight against leprosy and the associated stigma. Now, we will understand who are ASHA workers. ASHA workers are the community health workers who connect the marginalized community to India's healthcare system. The National Rural Health Mission, that is NRHM, first established the role of ASHA workers in 2005. They created awareness of health and mobilized the community towards local health planning. Thus, they are at the forefront of the healthcare delivery in India. There are around 10 lakh ASHA workers working currently in India. Now we will understand who can be a ASHA worker in India. A female resident of the respective village who is married, widow or divorced in the age group of 25 to 45 years qualified up to 10th grade will be selected as an ASHA worker by the Gram Panchayat, that is the local government. These criteria can also be relaxed if a suitable literate candidate is not available. ASHA workers are paid an honorarium in the range of 7,000 to 10,000 per month for their service. They also receive outcome-based remunerations. For example, if an ASHA worker facilitates an institutional delivery, she receives Rs 600. Currently in India, ASHA workers are demanding better wages and they should be made permanent employee of the Government of India. Now we will understand what are their roles and responsibilities. The task of ASHA workers include encouraging institutional births, bringing children to immunization clinic, encouraging family planning, treating the basic injury with first aid, maintaining demographic records and improving village sanitation. So this is all about the topic. Thanks for watching.